inflammation can play a role in orthopedic disorders, and there can be a long discussion around inflammation and its role. However, I tell my patients to think of inflammation as their friend. If there's an acute event, not necessarily trauma, but a moment in time when your symptoms begin, your body is going to normally mount an inflammatory response to that disorder, to that damage. You want your inflammatory response on behalf of your immune system to be acute, temporary, and effective. And if you can deal with the possibly pain that comes with that inflammatory response, taking up space in a joint, for example, then we want you to be able to deal with it. If you can't and you need some anti-inflammatory agents, not necessarily pharmaceuticals, but other avenues as well, then those are available to us. What I want to highlight today, however, is the interface between inflammation and a mechanical problem. When I think about orthopedic disorders, I think of inflammation separately. For orthopedics, I think most problems are mechanical, meaning a joint got tweaked, so to speak. There's also structural lesions, like a bone break, a tear in a meniscus, or a sprained ligament. And there's also tendinopathies where tissue becomes dysfunctional. Tissue dysfunction would be kind of the third major bucket. Most problems I find are mechanical. But if there's an acute mechanical event, like you tweak your shoulder or you throw out your back, there's likely going to be an inflammatory response that's appropriate and that will help you. So in the moment or hour or two or day after, mechanical therapies, i.e. movement in a certain direction, may not be fruitful. What I want people to understand is that the inflammation process may be dominating that presentation, if you will, very acutely. The first couple hours, the first day, the second day, possibly the third or fourth day. So for me to understand if there is a movement, if the problem is mechanical, we're not thinking it's structural, we're not thinking there's kind of long-standing tissue dysfunction, then we want to understand that it may take a little time before mechanical testing reveals itself to be fruitful. So if on Sunday you tweak your shoulder and you want to test, oh, maybe I need to move my shoulder in a certain way or move my neck in a certain way, and nothing is changing it, that doesn't necessarily mean it's not mechanical by nature of the disorder. Inflammation just may be playing a dominant role since it's just happened that day. So on Monday, what I would do is retest the motions based on a repeated movement exam and see if there's any effectiveness. If on Monday there's no effectiveness, then I conclude that inflammation is still playing a dominant role in the presentation, and I would try again either later that day or Tuesday. That interface, when inflammation starts to calm down and now the mechanical problem can be addressed, could be a few hours, it could be a few days. But it's important, if time is of the essence, to test regularly to see when mechanical repeated movement testing reveals itself to be effective. Again, I'm saying in these cases we're assuming or we've ruled out with an evaluation that it's not something more structural in nature. Most problems are not, especially without trauma, true structural damage. They are mechanical problems where the joint has moved in a specific direction and needs movement in a specific direction to get back on track. But I want patients to know that inflammation's on their side. It's helping them if you can deal with the effects of that inflammatory response, meaning you don't have to go run 10 miles tomorrow, so we don't have to quell that inflammation at all costs. Then we want inflammation to ride its course in order to help with the natural healing process. It's going to be more natural what your body does to defend itself than something that we would apply to it from outside the body, from externally, for example. So look for that interface between inflammation and mechanical. When movements start to become effective, that's when we're starting to think the inflammation is dying down. Now the presentation is more mechanical in nature and repeated movements in a certain direction are indicated.